Good morning, everybody. I'm Dr. Kusumvalli, Professor and Head, Department of Conservative Dentistry and Endodontics, Sri Rajiv Gandhi College of Dental Sciences. This session will be talking about tooth whitening modalities. Whitening teeth is not a new practice in dentistry. Yet in recent times, it has grown in popularity and is now one of the most frequently requested procedures in modern dental practice. Most patients desire an attractive smile, so a pleasing tooth color is a symbol of oral health to many people. Many patients approach dental treatment for the first time with whitening teeth as a primary motivator, since a healthy smile and appearance may improve self-image, increase self-confidence, and have a positive impact on the quality of life. The learning objectives at the end of the session, the students would be able to know the etiology of discoloration, types of tooth whitening techniques, mechanism of tooth whitening, procedures of various tooth whitening techniques, the advantages and disadvantages of various techniques. How is tooth whitening done? When is tooth whitening done? And what is utilized for tooth whitening is the question. So the tooth whitening is done when the teeth are discolored. But it's extremely important to know the etiology of tooth discoloration. The discolorant could be extrinsic in nature, or it could be intrinsic, or it could be a combination of both. Extrinsic staining is brought about by colored material or chromogenic material because of it being absorbed onto the plaque or the dental pellicle on the tooth surface. The longer the exposure, the deeper the stain and the harder it would be to remove. Extrinsic staining is brought about by diet beverages like coffee, tea, cola, and colored food substances absorbed onto the tooth. Mouth rinses like chlorhexidine can also bring about a discoloration of the tooth. Tobacco and pan stains is another reason that is a causative factor for discoloration of the tooth. Bacterial stains also can cause discoloration of the tooth. So you have seen very commonly, this is the kind of the teeth patients present with and come to us seeking treatment. Intrinsic staining is incorporation of the colored material or the chromogenic material into the enamel and dentin during the formative process or during odontogenesis and after eruption. These are classified as inherited developmental defects and systemic conditions, or it is because of trauma, or it is because of endodontic treatment. The inherited developmental defects and systemic conditions which cause discoloration are fluorosis, tetracycline, amelogenesis imperfecta, dentinogenesis imperfecta, congenital hypobilirubinemia, enamel hypoplasia. Fluorosis is a very common condition affecting many people in India, particularly in the southern states of Andhra Pradesh, Karnataka, and Tamil Nadu. It presents itself as a banding, or as you see in this particular slide, there is a banding or a brownish discoloration, or it could be whitish plaque-like appearance, or it could be a change in morphology of the tooth structure. Tetracycline stains are due to the changes that happen during dentin mineralization because of the combination of tetracycline with the calcium forming orthophosphate, and that causes staining. The amount and the duration affects the intensity and the distribution of staining. The tetracycline staining have a typical grayish appearance, as you can see. So the tetracycline stains could range from a mild gray stain to a darker grayish stains. These stains are very difficult to remove, and only if it is mild, it is amenable to bleaching. These dark discolorations cannot be removed with bleaching. Another very common cause of discoloration is trauma. The cause of most post-eruptive intrinsic staining is acute trauma. What happens is, during trauma, there could be a pulpal hemorrhage, and this causes the blood products to accumulate inside the tooth, and that's why the tooth might appear pink in color. Later it turns grayish, and lastly it appears blue-black, and that's when the patient approaches the dentist. The patient may not have any pain or any problem, but would like to have a change in color. The other causative factor is also because of endodontic treatment itself. It could be because of obturating materials. It could be because of the material, because of the pulp tissue left inside the root canal itself, or it could be because of intracanal medicaments which contain antibiotics. It also could, the discoloration can also be age related. It's because of secondary dentin deposition and thinning of the enamel and great exposure to external staining agent over a period of time, and also because of degradation of previously applied restorations. So before applying the treatment modalities, it's extremely important to establish the etiology of the discoloration. The presence or absence of the pulp tissue is also another important factor in determining the type of the bleaching procedure that could be applied. So the treatment modalities are broadly classified as microabrasion, bleaching, and a combination therapy. Microabrasion is a technique of removing very small amounts of tooth structure amounting to only a loss of about 25 microns. A water-soluble gel containing 18% hydrochloric acid and an abrasive compound is applied onto the tooth. Here we will talk about the technique of application or the technique of doing microabrasion. You can see that we have selected a case with very mild tooth discoloration, wherein it is a case of fluorosis where there are brownish stains in the middle third and it is very mild. So this technique is applicable for these kind of cases where they are mild, where there are mild brownish stains. It's very important to isolate the tooth with rubber dam, and there should be absolutely no leakage of the dam. Because of the nature of the material that we are using, a concentrated hydrochloric acid of about 18%. So after making a slurry of hydrochloric acid and pumice, you carry it onto the tooth with the help of cotton bud and apply it onto the tooth and apply a mild force onto the tooth. After you place it on the tooth for a few seconds, you wash it off and suction off all the excess. After suctioning off, you can see the change in the appearance wherein these mild brownish discoloration is not seen post-operatively. This was another case that was presented to the department. The patient had severe discoloration in the cervical third. It was diagnosed because of fluorosis. We could see this very severe brownish discoloration. We gave the patient a treatment plan of microabrasion followed by bleaching, and we subjected the patient to microabrasion technique, and this is the result that we achieved after 2 sessions of microabrasion. There was a remarkable improvement in appearance and the patient was really satisfied. We have done a couple of cases in the department with this technique and achieved very favorable results. You can see that this was the pre-operative case with fluorotic stains, and after subjecting the patient to microabrasion, we were able to achieve this favorable result. This is another case where there was a brownish staining, and post microabrasion, we were able to achieve a favorable result. In addition to a combination of hydrochloric acid and pumice, there is another method of bringing about microabrasion with chemicals, which is referred to as Meccan solution. Meccan solution initially was utilized in an acidic medium, wherein 5 parts of 30% hydrogen peroxide and 36% hydrochloric acid and ether were mixed together and applied onto the tooth structure. Having found that 36% hydrochloric acid could be very caustic to soft tissues, it's been changed recently, wherein we don't use bleaching with hydrochloric acid as a medium, but we make use of sodium hydroxide 20% as a medium in order to bring about a change in color. So the new Meccan solution contains 30% hydrogen peroxide, which bleaches the enamel, 20% sodium hydroxide, which etches the enamel, and 0.2% ether, which removes the surface debris. All these things can be mixed together, freshly prepared and applied onto the tooth, and it brings about a chemical microabrasion of the tooth structure. It's an extremely important technique and a very common question in the university examination, and it works very well for fluorosis cases. Now we move on to bleaching. The definition of bleaching It is referred to as the whitening of the tooth through the application of chemical agents to oxidize or reduce the organic pigmentation in the tooth. Bleaching is not new, as I have already spoken, that modern bleaching techniques began way back in 1918. Pearson in 1958 suggested intrapulpal bleaching. 1967, it was Nutting and Poe suggested walking bleach, wherein bleaching is conducted for non-vital teeth. 1978, in addition to application of superoxole, which is hydrogen peroxide 30%, heat and light was applied. 1989, there was a remarkable change in the technique where Dr. Van Haywood and Dr. Harold Heyman suggested making use of bleaching at home by the patient, but as specified by the dentist. As time went on, patients wanted bleaching and wanted improvement in color changes very quickly, and that's why laser bleaching became very popular from 1996 onwards. Bleaching can be classified according to the vitality and according to the procedure, whether it is conducted at home by the patient or in the office by the doctor. If it is done on vital teeth, it is referred to as vital bleaching. When it is done on non-vital teeth, it is referred to as non-vital bleaching. If it is done in the office, it is referred to as in-office bleaching. And if it is done by the patient at home, it is referred to as night guard bleaching. What brings about bleaching? Most of the time, the material that is utilized for bringing about bleaching is hydrogen peroxide. The concentration of hydrogen peroxide may vary from 5% to 35%. The higher concentrations being used for in-office techniques and lower percentage of hydrogen peroxide being used for at-home techniques. What makes a hydrogen peroxide a very favorable material for bleaching is because of its low molecular weight, it can penetrate through the porosities of the enamel, enter into the dentin tubules, release the oxygen, and breaks the double bonds of the organic and inorganic compounds inside the dentin tubules and brings about a change in color. Carbamide peroxide is another material that is utilized, and it is a white crystalline compound, and in a hydrophilic environment, it breaks down into approximately 3% hydrogen peroxide and 7% urea. Sodium perborate is another material that can be utilized for bleaching. It is available in a monohydrate, trihydrate, or a tetrahydrate form. It is available as a powder, and it is mixed with either hydrogen peroxide or water. When it comes into contact, it releases hydrogen peroxide and water. Again, the bleaching agent is hydrogen peroxide. There are several commercially available bleaching agents available in the market. In addition to hydrogen peroxide, there is a thickening agent, a flavoring agent, a coloring agent, and a preservative, and fluoride is added in order to reduce the postoperative sensitivity. All these agents are added in order to bring about a favorable material that can be applied onto the tooth structure, and it doesn't fall off the tooth when you place it. The mechanism of bleaching is when this hydrogen peroxide is placed on the tooth, there is a release of free radicals, and these free radicals attack the organic molecules to achieve stability. And this results in a reduction in absorption energy of the organic molecules in the tooth enamel. So having done that, darkly pigmented carbon ring structure convert into lightly pigmented carbon ring structure, and this happens to a point referred to as the saturation point. Beyond the saturation point, if the bleaching agent is kept on the tooth, there could be a change in the structure of the tooth, and it could be hazardous. That's why it's important for the patient not to do it on his or her own, but it has to be done by the guidance of the dentist. So we speak about a bleaching of vital teeth in the office. And in the office, bleaching procedures can be brought about by what is referred to as thermocatalytic method, by making use of light and heat. And you can also bring about office bleaching by making use of several commercially available products. Vital tooth bleaching can also be done by a procedure called night guard vital bleaching. wherein the patient is doing the bleaching at home as prescribed by the dentist. And whitening bleaching can also be brought about by several over-the-counter preparation, where the patient buys these preparations and apply it onto the tooth to bring about a change in color. In-office vital bleaching is one of the least invasive and most conservative treatment, to the extent that no tooth structure is lost, and that's why it is referred to as a minimally invasive technique. This technique can be applied to very light enamel discolorations, to very mild tetracycline discoloration, endemic fluorosis discoloration, and age-related discoloration. Contraindications to bleaching, it's very important to select the patient because you cannot choose patients with unrealistic goals. So you have to tell the patient what can be expected with bleaching and how much of color change can be achieved with this procedure. You have to select the shade as a dentist, determine the etiology, and you have to determine whether bleaching will actually improve the aesthetic appearance. There are some cases where there could be dental hypersensitivity, and these symptoms of hypersensitivity can occur if you tend to ignore severe cases of attrition, abrasion, erosion, or abfraction. In short, if there is any enamel loss, it results in hypersensitivity after the bleaching procedure is brought about. So also, you cannot do bleaching procedure when the patient has severe dental caries, because there's a great deal of exposure of dentin, and this results in severe hypersensitivity. Even if the tooth is heavily restored, there's hardly any dentin tooth structure in order to bring about a bleaching procedure. So it's not going to bleach restoration, it's only going to bleach tooth structure. So don't end up trying to bleach a badly discolored tooth because of a badly discolored restoration. Do not apply this technique of tooth whitening for dark discoloration. If there is a severe enamel loss for whatever cause, you should not apply this technique. So case selection is extremely important. So prior to embarking on the procedure, it's important to familiarize the patient and let the patient know what the cause or the etiology of discoloration is. Also, explain to the patient the procedure that you are going to follow. Explain to the patient expected outcome and the improvement in change, and also tell the patient of the possibility of future discoloration. Prior to embarking on the procedure, it's very important to take radiographs so that this will detect all the carious lesions. If you do not control the caries prior to embarking on the bleaching procedure, the patient is going to have severe hypersensitivity. So all defective restorations have to be replaced, and any cases with deep dental caries have to be restored first prior to embarking on bleaching procedure. It's very important to record by means of photographs the exact shade of the tooth with the shade guide, and also with the help of clinical photographs and videographs if required. In general, prior to application of the bleaching agent, it's very important to protect the soft tissue. So the soft tissue has to be protected with the help of Vaseline or Orabase completely. After application of Orabase, you have to protect the patient with rubber dam. The rubber dam has to be applied very efficiently, and it should be completely leak proof, because you're making use of a high concentration of hydrogen peroxide, that is 30%, and this should not leak and cause any damage to the soft tissue. You can see a floss is applied and tied around the tooth, and you also invert the dam into the gingival sulcus so that there is no leakage of the dam, and so there is no leakage of the bleaching agent into the oral cavity. This is the dam applied, and the floss is tied all around the tooth, and you have the section, the entire section is isolated with a rubber dam. There should be absolutely no leakage of the bleaching agent. Earlier, we made use this thermocatalytic method, where we made use of heat in order to activate the bleaching agent. So here in this case, we are trying to bleach the upper arch. So we have to protect the lower arch. So you take a gauze and you moisten it with water and apply it onto the lower arch and protect the lower arch while you're bleaching the upper arch. So you take the superoxole or 30% hydrogen peroxide and you wet the gauze in 30% hydrogen peroxide, apply it onto the upper arch where you're trying to obtain a change in color, or you're applying the bleaching technique onto the upper arch. Subsequent to that, you can apply the bleaching agent onto the lingual surface as well. Make sure you protect the patient with eyeglasses and subject it to a bleaching light. So this bleaching light just enhances the action of the hydrogen peroxide, but you have to be very cautious, and the bleaching light, the intensity has to be slowly increased, making sure that the patient is comfortable, and ask the patient to indicate any kind of symptoms of hypersensitivity or pain and immediately reduce the heat application. You have to apply light and apply the solution for about 4 to 5 minutes on a particular tooth, and you can make use of a timer so that it does not exceed the time. Once you have brought about the bleaching, then it is important that you suction off all the excess prior to removing the rubber dam, and make sure no leakage happens and no material gets into the oral cavity before removal of the rubber dam. In addition to thermocatalytic bleaching, there is something called as power bleaching, wherein they make use of a plasma arc light. So this plasma arc light are special high intensity lights which are available in the market. This can bring about bleaching in a very short period, are very popular in certain areas, so that the patient is very happy because the change in color happens in less than 3 seconds per tooth. There are bleaching agents commercially available that could be activated with the help of conventional of a tungsten halogen curing light. But this is a very time consuming process, and it takes about 1 minute or 40 seconds to 60 seconds per tooth. Lasers have become a very popular method of bringing about a color change in the patient's mouth for bleaching procedure. In addition to all this, you've got several commercial products that are available in the market that you could bring about bleaching in the office. So let me illustrate a case of in-office bleaching by making use of commercial products. I will not mention, there are many commercial products available, and it is extremely important to select good commercial products, and this is the procedure that we follow with the commercial products that are available. Of course, you have to make use of a rubber dam. Here we've used a Optra dam. This Optra dam retracts all the soft tissues and the lips. We select the shade of the tooth prior to starting off the bleaching procedure. These are the shade tabs. Establish the shade of the tooth. Take photographs. Apply the liquid dam onto the soft tissue. This is the syringe extruding the liquid dam. After you extrude the liquid dam, subject it to light curing, and this will protect the soft tissue from any bleaching agent that is applied onto the tooth structure. Apply the bleaching agent. This can be extruded from the syringe. It is extruded from the syringe, applied onto the tooth structure, and it can be gently agitated. It's very important to have a consistency that will not drop off from the tooth structure. You agitate the commercially applied material. For every 5 minutes, you have to agitate it. After application, according to the manufacturer's instruction, you suction off the excess. You should not allow the patient to rinse, because any rinsing will make the material go into the oral cavity, and the patient is going to have great changes in the soft tissues, and the patient is not going to be happy about it. After 2 to 3 15-minute sessions, according to the manufacturer's instruction, we can flick off the liquid dam and remove the opal dam. So post-operatively, you can see that you have obtained a change in color from the shade was a darker shade, and you have achieved an improvement in shade after applying the bleaching material. It is important that a remineralizing paste is applied onto the tooth structure. This reduces the post-operative sensitivity for the patient, and this is provided along with the commercially available materials. We had several cases in the department where we have done this technique of commercially available materials were applied onto the discolored teeth, In this case, we have made use of polar office. We have applied the polar office onto the tooth structure after protecting the soft tissue with the liquid dam. After application of the polar office material onto the tooth structure, we applied the bleaching light. And after applying the bleaching light, we got an improvement in appearance from a yellowish brownish discoloration to a fairly white color where the patient was sufficiently satisfied. This was another case with a discoloration of brownish discoloration. We made use of commercially available material applied onto the tooth and we got an improvement in color. This was another case with a brownish discoloration in the cervical and the middle thirds. A shade was selected, we applied the bleaching agent and we brought an improvement in color. This was also another yellowish discoloration. Patient requested for an improvement in color. We made use of commercially available material after protecting the soft tissue and we brought a remarkable change in color and the patient had a very satisfactory result. It's extremely important after the bleaching technique, the patient should maintain with a toothpaste that is provided with the commercially available paste, and subsequently very important to inform the patient that the bleaching technique will retain the shade for about 18 to 24 months and it may be required to have a top up after these few months. It may be required to repeat the session. Next session we shall talk about bleaching that is done at home as well as bleaching that is done on non-vital teeth. Thank you.